All right, so we're ready to do our patch test. I do patch tests if people have a really long list of allergies or any concerns about metals, anything like that. The blades we use are stainless steel, but sometimes there can be trace amounts of nickel in them. So if someone has really heavy metal allergies, it's not a bad idea to do a patch test. Also, if they're concerned about allergies to numbing products, aftercare, or even the pigment, do your patch test. But always, document which side we're going to do it on. We're going to be doing it on her left side. On my tray here, I have all the products that I would use during the procedure. So I have our rubbing alcohol that I'm going to cleanse with, and then I'm going to add a little bit of primary numb just for a few seconds. It's not going to be on there very long, and I might use my micro scrub just to kind of rough up the skin with the primary numb. Let it sit on for about 60 seconds. I'm going to load my microblade, and I'm going to dip it in a little bit of pigment and just add little scratches in with her hairline so that if the pigment happens to heal in, which most likely it won't because we're not going to be doing a full aftercare protocol, but if the pigment were to heal in, then it would just look like an extra little hair stroke in her hair. And then I have my secondary numbing that I use as well, and then I'm going to wipe with a baby wipe and finish off with a bit of aftercare that she will leave with. And then we're gonna know within 24 to 48 hours if there's any type of reaction. People always say, how will I know if I'm having a reaction? And I tell them, you're gonna know. If you have to ask, if you have to get someone to get in there and look, and you're most not likely not having any type of reaction. We've had one in the history of my studio, and it was obvious hives running down their neck. So I've never had anybody that had an allergic reaction other than that case from a patch test. So I only do them when necessary, but you do have to check with your local health authorities, depending on where you are in the world, if you're in the United States, depending on which state, which province, if you're in Canada. So you have to check with your local health authorities as well as your insurance to see if a patch test is something they're going to require. Not all places do, not all insurances do, but you want to make sure all your bases are covered in the event someone were to have a very bad reaction. Okay, so for a patch test, you're still going to want to obtain an informed consent. Anytime you're doing a treatment or a procedure on a client, you want to have an informed consent, and even more so because we are going to be breaking the skin a little bit by needling a little bit of that pigment in behind the ear. So it doesn't matter if it's your best friend, your mom, your sister, anybody that you know really well still needs to sign an informed consent for the patch test. You can make it part of your generic tattoo waiver, or you can have a separate patch test consent form. Thank you very much. So once you get your consent, you're also going to want to make sure you document everything. So still recording your needle, your lot number, expiry dates of all your products, the pigment you used, just every little detail. And then of course, what side you're going to be doing the patch test on. We decided to do it on her left side behind her ear. So I'm going to write on here patch test behind left ear into hairline, and all the details that go with it. So always still documenting, still treating this like it is a procedure. Whether or not to charge for a patch test is completely up to you. I do charge for a patch test because I am opening product, as you're gonna see. I'm opening a needle. I'm still, using my time as well. So I charge a $50 product cost. However, if the client is able to go through with the procedure, I decide to apply that $50 to their procedure. So that's one way you can do it, just to make sure people aren't going to be wasting your product and your time if they're not truly interested in following through. So you can choose to charge or not to charge. That's completely up to you, but regardless, you do have to do the appropriate paperwork and documentation. We're going to clean our area first, and I'm just going to kind of clean all behind the ear and into the hairline and make sure that area is nice and saturated with the rubbing alcohol. Now I'm going to take my primary numbing cream, and I'm just going to kind of do this little area into her hairline. So, we're not looking to numb the area entirely. We're just looking for a reaction with the skin. So I'm going to kind of scratch the area here, rough it up a little bit, and let that sit for a minute. Now, if somebody was concerned about a reaction to the numbing and a reaction to the pigment, and you wanted to differentiate the two, because maybe if they said, well, I'm allergic to the numbing, then I'd like to do it without numbing. but you want to still verify that they're not allergic to anything else as part of the procedure. You can do a patch test on both sides. You could do one patch test with just scratching the numbing in, even using your blade to kind of scratch the numbing in. And then on the other side, you could do a little scratch of pigment without numbing. We're not trying to get that stroke to stay, so it should be very superficial. It should not be painful for the client. They might feel like you're kind of scratching with a toothpick, but it shouldn't be painful. And then just make sure you document, behind the right ear, if you did pigment, behind the left ear, it was a test for numbing, that kind of thing. Just make sure you document everything that you do. But in this case, we're just going to kind of test to make sure that she's not allergic to any part of the procedure. So now the numbing's been sitting on there, so I'm going to give it a little wipe. I'll use my rubbing alcohol again. Okay. I'm going to load my microblade. Remember to always open a new needle in front of the clients. I'm using a little bit of pigment, you don't need much. And I'm just gonna go right into her hairline here. And I'm gonna try to mimic her hair so that if for some reason a little bit of the pigment heals in, it should shed out within the month, but that way it'll just blend with her hair. So I'm just gonna do a little scratch here. Does that feel okay? Mm-hmm. Yeah. And I heard my little Velcro sound, knowing that I did open the skin. I'm gonna take my secondary numbing here and just rub that around. And I'm gonna let that sit for a few minutes, or I should say a few seconds, not really even a few minutes. And we're just gonna let that soak in and have some contact time. Some people will put a little swatch of the pigment without breaking the skin. You can do that if you'd like to just put a little swatch of the pigment, if that's all you're kind of concerned about. I still like to break the skin and get it in there just because that is what we're doing with our procedure. And I want to make sure that it's getting full contact in there to make sure we're not going to have any complications with reactions. So after it's had a few seconds to sit on there, I'm just going to take my baby wipe and I'm just going to clean off the excess. Like I said, there's you can see a couple strokes. I don't know if you want to zoom in here. Got some pinpoint bleeding, very, very little. If you wanted to, if you were still concerned about the pigment, you could take a little bit of pigment here and kind of put it into the strokes. Let that sit for a couple seconds and just kind of gently dab it away so that you make sure it's kind of still in there. But again, we don't really want them to be noticeable in the event that they do heal in. We're just trying to get the product to have good contact with the skin. And then this is my medicated aftercare ointment, so I'm just going to put a little tiny bit in there. And that's it. So in this case, I tell my clients they don't have to worry about, not saturating the area. They can return to washing their hair the next day. I do tell them to be cautious, just because it is a bit of a scratch behind their ear. So just because it is open skin, just be careful. Try not to, have any contact with lake swimming pools for the rest of the day, at least 24 hours. Make sure that skin can kind of get a little scab on it and heal up. And they can resume washing their hair and all daily activities as normal, usually within 24 hours. And like I said, if they were to have a reaction, you would know within 24 to 48 hours, and it would be pretty obvious in our experience. So that's it. That's how you do your patch test.